Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Enteral nutrition and its complications. So first is the tube related. So under the tube related, and this is we need to know it is MC, most common. So what are the findings here? So it includes the malposition, and there is also the displacement. Next is the presence of the blockage. So there's blockage as well as there is breakage. There is blockage, is breakage and leakage. So there's blockage, breakage and leakage. Then there are some presence of the local complications. So local complications also are present. So example of this is it includes the erosion of the skin and the mucosa. So it is nothing but the erosion, and this is of the skin as well as the mucosa. Next we move on to the gastrointestinal. So gastrointestinal is the GI. So here the complications of the enteral nutrition, it includes there can be diarrhea, there can be bloating, nausea as well as vomiting. Then there can be presence of the abdominal cramps. So there is abdominal cramps, then there is aspiration as well as the constipation. Then we move on to the metabolic or the biochemical. So metabolic or the biochemical, there is the electrolyte disorders. So there's electrolyte disorders. Then there is also the vitamin and mineral. There's vitamin and mineral or the trace elements, vitamin, mineral, trace elements deficiencies. Next is there is presence of the drug interactions. There is presence of the drug interactions. The last group is include the infective. So under the infective, there is the exogenous and the endogenous. There is exogenous. So exogenous is nothing but the handling the contamination. So we handle the contamination, and endogenous is the patient. Is from the patient. To learn and grow daily like this, please do subscribe. Thank you.